They thought the new night nurse was just a fill-in until the ranger's heart went silent under the trauma lights. One long flat line. One room full of trained professionals. And one woman nobody respected enough to listen to until death was already in the bed. Here is the question that should hurt if the person you loved was bleeding out in front of you. Would you trust the title on the badge or the hands that knew how to bring them back? Outside, Harbor Ridge Medical Center, Tacoma, was drowning in rain diesel and midnight traffic. Inside, the ER smelled like bleach-bad coffee, wet jackets, and fear. This story is not just about a life or death save. It is about pressure-buried, identity-broken systems and the moment skill matters more than rank. Stay with me to the end. Then, like this video, comment your city and tell me where you're watching from. That question hung in the air whether anyone said it out loud or not. By the end of the night, it would feel like a knife. At the beginning, it was only rain on the glass and another shift that nobody expected to remember. Tacoma never looked fully asleep when the weather turned ugly. Past midnight, the city still breathed in pockets. Harbor cranes stood over the port like black ribs against the clouds. Headlights moved through sheets of rain on Interstate 5. The wet streets around Harbor Ridge Medical Center shone under traffic lights in blurred red and yellow streaks, the kind that made the whole world look half underwater. Wind shoved hard against the hospital windows and sent water skimming sideways across the parking lot. Ambulance lights flashed now and then in the distance, not dramatic from far away, just another pulse in a city that was always chewing through the night. Inside the emergency department, the storm changed shape. It became fluorescent light and overheated air. It smelled like antiseptic stale coffee, damp coats, printer toner, and the low-acid note of fear people carried on their skin when they had been waiting too long for somebody to tell them what came next. The monitors made their own weather. Beeps, alarms, the hush of oxygen, a cough behind a curtain, the short, sharp cry of a child who had held it together until the needle came out, the squeak of shoes over polished floor, the overhead speaker clearing its throat before another page. At the nurse's station, shift change was happening the way it always happened in a busy hospital. Not cleanly, not all at once. A tech signed out and another slid into the open chair before the seat had even gone cold. Someone left half a protein bar by a keyboard. 2 admit holds were still parked in the hallway beds because upstairs had nowhere to put them. A paramedic rolled in a college kid with a split eyebrow and the guilty look of someone who had lost a fight with a scooter and hoped nobody would ask too many questions. Avery Wells moved through all of it without asking the room to notice her. That was the first thing people saw, and the last thing they understood about her. She did not enter a space like she wanted to own it. She entered like she already knew where every sharp edge was. Her navy scrubs were a size too big soft at the knees, borrowed looking in a way that made her seem smaller than she was. Her badge read Avery Wells RN in plain black letters. No decorations, no extra certifications clipped below it. Her brown hair was pinned back in a tight knot that had nothing fashionable about it. She wore no rings, no bright shoes, no little habit that made a person easy to remember. If someone had glanced up and then looked away, they might have registered only a quiet night nurse starting another shift. If they had watched longer, they would have noticed the rest. She never rushed, but she never wasted movement. She turned corners without colliding with anyone. She glanced once at a monitor and remembered the rhythm. She could step into a room, take in the patient, the family member, the IV, pump the positioning of the oxygen tubing, and know what needed fixing before anyone opened their mouth. Her hands moved fast when they had to, but the speed came from precision, not panic. At the station, charge nurse Denise Rowe stood over the board with a dry erase marker in one hand and a cold cup of coffee in the other. Denise had been in emergency medicine long enough to recognize 3 kinds of people on site. People who froze, people who performed, people who worked. She had no patience for the first 2 and only enough energy for the third. Wells, she said without looking up, You have 12-9 and hallway C. Keep one eye on detox in 6. Security's busy with the guy in triage who swears registration stole his wallet. Avery glanced at the board. Bed 12 was an elderly fall on blood thinners. Bed 9 was abdominal pain male, late 40s, no imaging yet. Hallway C was a boarder, waiting on medicine. Detox in 6 had already cursed at 2 nurses and tried to pull his own IV. Copy, Avery said. Her voice matched the rest of her. Low. Plain. No edge in it. No performance of cheer or exhaustion. She logged into the charting system and started moving through the records. Beside her, Nurse Nina Parker slid into the next chair with a paper cup of coffee and the restless energy of somebody still new enough to believe every shift would teach her who she was. Nina had only been on nights for a few months. She was quick, compassionate, and not yet very good at hiding what she felt. She leaned closer and lowered her voice. You got Mrs. Delaney in 12. She keeps apologizing for bleeding. Avery looked at the chart. Forehead laceration, warfarin, fell in the bathroom. She told me she didn't want to be any trouble. Everybody says that when they think trouble costs money, Avery said. Nina blinked, then smiled despite herself. You always talk like that. Like what? Like you've already heard the ending. Avery clicked into the medication reconciliation screen. Hospitals only have a few endings. Mostly, people hope theirs gets delayed. Nina studied her for a second. Avery did not look up. Her eyes kept moving over the screen. Allergies, INR vitals, medication history, last dose times. She seemed to absorb information the way dry paper absorbed water. That clinic job you came from, Nina said. Was it really out near Puyallup? That's what HR says. Nina laughed softly. You answer weird. So, do charts. Nina shook her head, still smiling, and took a sip of coffee that was bad enough to change her expression. Avery glanced sideways at the cup. Burnt. It tastes like somebody brewed it through a sock. That means it's fresh. Nina let out a quick laugh, and it surprised her enough that she looked at Avery again. There had almost been a smile there. Almost. Then the physician workroom door opened and the mood at the nurses' station tightened by a degree. Dr. Trent Calloway came out buttoning the cuff of his white coat like he had just walked onto a stage he did not intend to share. He was tall in a way that had probably served him well his whole life, with neat dark hair, an expensive watch, and the posture of a man who believed frustration was something lesser people caused him. His stethoscope hung around his neck like an accessory. He had the clean, polished face of someone who took anger personally when it rose around him. Even before he spoke, the resident straightened. Calloway's eyes skimmed the station until they landed on Avery. Where's the chart for Bed 8? Avery did not flinch. Bed 8 discharged 20 minutes ago. Calloway stopped. That's not what I asked. It's still the answer. Nina went very still. Calloway's gaze sharpened. He stepped closer, close enough that the smell of his expensive cologne cut through the coffee and hospital air. I said Bed 8. Avery turned the screen slightly so he could see the trackboard. Chest pain, rule out. Serial troponins negative. Repeat ECG clean. Discharge instructions printed. He left with his wife at 12:37. For a second, Calloway stared at the screen as if it had inconvenienced him by supporting her. Then he looked back at Avery, and Nina saw the exact moment his irritation became personal. Do not think for me, he said quietly. Just answer the question you're asked. Avery met his eyes for one beat, calm as still water. Yes, doctor. It should have ended there. Instead, he let his gaze drop to her badge, then back up as if confirming her place in the order of things. You're the new float nurse, right? Temporary coverage, Avery said. Then focus on tasks. Nights move fast here. People who try to get ahead of themselves tend to make messes. Nina opened her mouth before she could stop herself. She was only telling you the patient left. Calloway turned to Nina with a look that had made more than one resident regret existing within range of it. And you are helping how? Nina swallowed. I'm not. No, he said. You're not. He moved on, coat swaying behind him, already reaching for a resident who trailed him like a second thought. Nina stared after him, furious on Avery's behalf and her own. I hate him, she muttered. Avery turned back to the chart. That takes energy. Nina leaned an elbow on the counter. How do you do that? Do what? Stand there while he talks to you like you're disposable. Avery scanned the lab values on bed 12. He talks to everyone like that. That doesn't make it normal. No, Avery said. It doesn't. Nina waited for more. None came. Avery printed medication labels, gathered supplies for bed 12, and stood. You ever think about reporting him? Nina asked. Avery pulled on gloves. To who? Nina frowned. HR. Avery's mouth shifted, not quite amused. HR protects the building. Nina stared at her. That is a dark answer. It's an honest one. She walked down the hall before Nina could ask anything else. Bed 12 smelled faintly of baby powder and rainwater. Mrs. Delaney lay propped against a pillow with gauze taped to her forehead and embarrassment written all over her face. She had silver hair plastered damp against her temples, and both hands folded over the blanket as if she were trying to make herself smaller. I'm sorry, she said the moment Avery stepped in. I know there are worse people here than me. Avery closed the privacy curtain, washed her hands, and moved to the bedside. You're here because you hit your head while taking blood thinners. Mrs. Delaney gave a weak little shrug. Still, Avery checked the dressing. No heavy active bleed. Good capillary refill. Bruising already settling around the left cheekbone. You don't have to earn care, Avery said. You already need it. Mrs. Delaney looked at her with watery surprise. That's a nice thing to say. It isn't nice, Avery said. It's true. That got the woman to laugh, a thin and shaky sound, but real. As Avery took her vitals, she asked the questions gently and directly. Any loss of consciousness, any vomiting, any new headache, any chest pain before the fall, any dizziness. She listened to answers and to the places where answers hesitated. My husband always told me I'd take a hard spill one day, Mrs. Delaney said. Avery adjusted the blood pressure cuff. Did he say what you'd do after? Mrs. Delaney blinked. After what? After you got up. That earned another laugh, this one steadier. Complain, probably. Then you're on schedule. When Avery finished, she wrote the plan on the whiteboard in large, clean letters. CT scan, labs, recheck. The kind of simple order that gave frightened people something to hold on to. Out in the hall, the ER carried on in its usual strained rhythm. A man in triage argued that his ankle could not be broken because he had already driven himself there. A toddler wailed over a pulse ox sticker. Somewhere behind a curtain, somebody asked for water in the tone of a person who had been asking for 15 minutes and was beginning to feel abandoned by civilization. Avery crossed to bed 9. The man there had the hard face of someone who worked with his hands and resented needing help. He was lying on his side knees, pulled slightly up, one palm pressed against his right lower abdomen. When she stepped in, he straightened too quickly and tried to act like he had been fine all along. Just stress, he said before she even asked. Avery clipped the pulse ox to his finger. Stress doesn't usually make people guard the right lower quadrant. He looked at her, caught. Maybe I slept wrong. Maybe. She listened to his history. Pain since afternoon. Worse with movement. No appetite. One episode of nausea. He tried to downplay everything, but his breathing changed when her fingers pressed the right spot. A tiny hitch. Barely there. Enough. He winced. Avery met his eyes. How long since you ate? I'm not hungry. That wasn't the question. His mouth tightened. Lunch, maybe. Any fever? I didn't check. Any vomiting? Number. Any pain when you walk? He hesitated. Avery nodded once. I'm going to get the doctor. His eyes flashed with sudden anxiety. Is it serious? It deserves attention, she said. When she stepped back to the station, Calloway was leaning against the physician counter laughing quietly at something on his phone, while a second-year resident waited nearby with the expression of a man trying to guess how safe it was to interrupt. Avery stopped at the edge of the counter. Bed 9 has right lower quadrant tenderness with guarding and rebound. Calloway did not look up at first. Chart it. I did. Then I'll see it. He's getting worse. Now he looked up annoyed. You are not the one deciding that. Avery held his gaze. No. I'm the one telling you. The resident glanced between them. Calloway slipped the phone into his pocket. Do not hover, Nurse Wells. Put it in the note. I'll get there. She had already done that. She turned away without saying it. Nina caught her by the sink and read the answer in her face anyway. He blew you off. He heard me. That is not the same thing. No, Avery said, it isn't. She washed her hands with a concentration that made the act look almost ceremonial. Water hot enough to pink the skin. Soap into every crease. Wrist nails, fingers palms. No wasted motion. Nina leaned against the counter, still keyed up from the exchange. You scrub like the sink insulted you. Avery kept washing. Hands carry consequences. Nina's eyes dropped to Avery's forearm where the sleeve had pulled back. In the harsh hospital light, the scar was impossible to miss this time. It ran jagged along the inside of the arm, old and pale. In some places thicker, in others like something had torn through flesh, and somebody had closed it under less than ideal conditions. That definitely did not happen at a family clinic, Nina said softly. For a moment, the only sound between them was the water. Then Avery pulled the sleeve down. It happened a long time ago. Nina recognized the closed door in her tone, but curiosity got one more step out of her. You were military. Avery shut off the tap. A lot of people were. That is not a no. Avery dried her hands. It's also not a conversation. Nina nodded, chastened, but she watched Avery walk away and knew she had not been imagining the difference. The scar. The stillness. The way she saw things before other people said them out loud. Whatever Avery Wells had done before Harbor Ridge, it had not been flu shots and school physicals. A little after 1 in the morning, the waiting room hit its usual wall. That hour had a personality in emergency departments. Midnight still carried momentum. 1 o'clock carried fatigue. Patients grew louder. Families grew sharper. Staff started counting how many hours remained without meaning to. The vending machine hummed like a tired insect. Wet umbrella water spread in dark puddles near the door. Registration had 3 clipboards out at once. Security was nowhere useful. Denise Rowe came off a phone call looking like she wanted to fight the entire inpatient bed management team one by one. Medicine still has no beds, she announced to no one and everyone. So if anyone wants to invent a 4th floor out of drywall and prayer, now would be the time. A tech snorted. Nina shook her head and grabbed a blanket for hallway C. Avery was in the supply room counting IV catheters because inventory in a hospital was a kind of weather too. If you ignored it, it became a storm at the worst possible time. The room was cramped and overbright. Gauze in crooked stacks, tape rolls shoved behind saline flushes, a handwritten sign on the shelf that read, "Please do not hoard," as if pleading had ever fixed scarcity. Avery squared the bins, checked expiration dates, and lined up the packages in clean rows. She was stepping back out with an armful of supplies when Calloway blocked the doorway. His expression already said he had decided this interaction would irritate him. "Where have you been?" "Restocking. You were supposed to be on the floor." "I am on the floor." His mouth twitched with the effort it took not to hear the literal truth. "The supply room doesn't count. It does when we run out." Calloway looked at the supplies in her arms as if they offended him. Why is this department always short on everything? Because people use things. The answer hung there for half a second before he realized she had not been trying to be funny. His eyes narrowed. "Do not get smart with me." Avery stood still in the narrow doorway, the bins balanced against her hip, and did not step back. That was the thing about her. She never puffed up, never challenged with volume. She simply held ground in a way that made other people realize they had not actually taken it. For one odd second, Calloway looked like a man who had expected a hallway to move and found stone instead. Then he scoffed and stepped aside. "Get back to work." Avery walked past him. At the station, Nina saw the exchange and caught up with her by the med cart. "You ever think about quitting?" Avery scanned a medication label. "No, you answered too fast." "That's because I know." Nina lowered her voice. "This place is a mess." Avery drew up the ordered dose, checked the patient name again, and capped the syringe. "Most places are. So why stay?" Avery looked down the hall, where a transport tech was arguing softly with a confused patient about why he could not smoke before CT. "Because this one is quiet," she said. Nina laughed in disbelief. "This is quiet to you." Avery did not answer. Denise Rowe glanced up from the trackboard just in time to see that exchange, too. Denise had been watching Avery all shift in the way experienced charge nurses watched anything that did not fit neatly in the usual categories. She had seen skilled nurses before, burned-out nurses, traumatized nurses, brilliant ones who hid behind sarcasm, quiet ones who fell apart by hour 4. Avery did not read like any of them. Denise spoke without preamble. "You worked trauma before." Avery turned. "Not here." "That also wasn't what I asked." For the first time that night, something like a shadow moved behind Avery's eyes. Not fear. Memory. "I've seen busy rooms," she said. Denise held her gaze, then nodded once. "So keep seeing this one." A patient in 6 started shouting for a blanket. Another in Hall C wanted to know why his soup had not arrived. Someone down the corridor muttered that they were going to leave and call their lawyer. Avery moved through the next stretch of the night the way she moved through everything. She checked detox in 6 and spoke to him without flinching when he cursed at her. She settled hallway C with an extra pillow and a quieter explanation than anyone else had bothered to give. She caught a medication scan mismatch before it reached a patient. She noticed a triage tech limping and silently traded assignments so the tech could sit for 5 minutes. None of it was dramatic. All of it kept the floor from sliding 1 inch farther toward chaos. And that more than anything was why people began looking for her without admitting it. When a family member needed the plain truth instead of comfort language, they found Avery. When a patient started to spiral and needed calm, Avery was already there. When something felt off, and nobody could yet name why, the eyes at the station turned toward the quiet nurse in the oversized scrubs. At 1:47, the red EMS phone rang. Not like the desk lines. Not politely. It cut through the unit sharp enough to make half the station look up at once. Nina startled so hard she nearly dropped a med cup. Denise's coffee paused halfway to her mouth. Avery reached for the receiver before the second ring. "Harbor Ridge emergency," she said. Her voice changed. Not in volume, in shape. Purpose stripped everything soft out of it. She listened. Her eyes fixed on nothing, and then on everything at once. Around her, the station seemed to lean towards the silence on her side of the call. "Yes," she said. "Go ahead." A beat. Another. Her posture tightened by a fraction. "What's your arrival time?" More listening. Understood. Which side? Her free hand was already moving, reaching for the trauma board marker before anyone had told her to. Any airway compromise. Blood pressure. Mechanism. Nina stared. Denise watched her more closely now than she had all night. Then Avery said, "Copy that. We'll be ready." She hung up and turned. Denise was already standing. "What do we have?" Avery didn't waste a word. Multi-vehicle collision on Interstate 5 just south of the port. 1 critical inbound. Male, 32 active duty Army Ranger. Prolonged extrication. Penetrating trauma to left chest and upper abdomen. Hypotensive. Tachycardic. Wet respirations. Blood pressure 80/40 on scene and falling. They are 6 minutes out. The trackboard, the coffee, the petty frustrations of the last hour, all of it vanished under the weight of those numbers. Denise moved first. Trauma Bay 1. Nina, get the fluid warmer. Wake respiratory. Tell blood bank we may need massive transfusion. A tech was already moving the crash cart. A resident appeared from the hall, eyes widening as the room changed temperature. Then Calloway came out of the physician area, irritation on his face because the department had shifted without him. "What's going on?" Avery met his eyes and recited the numbers again, exact and steady, as if she were reading them off a wall no one else could see. For the first time all night, Calloway did not interrupt her. Something in the report had reached the part of him that still knew danger when it heard it. "Fine," he said. "Trauma Bay 1, let's move." Nina was already halfway there with the fluid warmer in her arms. Denise barked for blood and backup. Respiratory opened drawers. The empty bed under the trauma lights waited like a held breath. Avery walked toward the bay with a pair of gloves in one pocket and a stillness in her shoulders that did not belong to a routine shift. Outside, rain slammed harder against the ambulance entrance. Inside, the automatic doors opened on a rush of diesel-wet air and shouting, and the gurney came through with Staff Sergeant Luke Ryland bleeding under the lights. The gurney hit the threshold hard enough to rattle the rails, and the whole department seemed to tighten around the sound. Rain came in with them. Cold air. Diesel exhaust. Wet boot soles squeaking over tile. The paramedics were slick with weather and sweat faces set in that narrow, urgent focus people wore when they had been fighting a losing battle in the back of a moving truck and had not yet admitted how close they were to the edge. One of them kept a hand braced on the patient's shoulder to steady him as the wheels jumped the seams in the floor. On the stretcher lay Staff Sergeant Luke Ryland. He looked less like a person than the aftermath of force. His tactical shirt had been cut open from collar to waist. The fabric was black with blood where it had once been tan. His skin had gone gray under the trauma lights, the particular gray that made every medic in the room instinctively move faster. Dirt and glass dust streaked his throat and jaw. A rigid dressing had been packed over the left side of his chest and upper abdomen, but it was already soaked through. Each breath sounded wet, shallow wrong. The lead paramedic did not waste time with flourish. 32-year-old male. Active duty Army Ranger. Multi-vehicle collision southbound I-5. Prolonged extrication around 45 minutes. Metal intrusion into left thorax and upper abdomen from the driver's side frame. Field dressing placed. 2 large bore IVs. We gave fluids, but pressure has been trending down the whole ride. Last blood pressure 82/46. Pulse 136. Saturations low 90s with high-flow oxygen. He lost responsiveness twice. Came back both times. He is fading. Denise Rowe was already moving around the left side of the bed. Transfer on 3. 1, 2, 3. They lifted Luke onto the trauma mattress. His body gave a guttural sound that did not quite make it all the way to consciousness. His head rolled to the side. For one thin second, his eyes opened under the lights and fixed on nothing. Then they were half closed again. Calloway stepped in at the foot of the bed and snapped on gloves. His voice came up half a notch louder than usual, sharpened by the size of the room now looking at him. "Airway. Patent." For the moment, the respiratory therapist answered, moving into position with mask and intubation setup. "He's tiring. Breathing." A resident leaned in with a stethoscope. Diminished on the left. Breath sounds present on the right. Wet, maybe hemothorax. Circulation. Nina called from the monitor. Heart rate 138. Pressure 80/44 and sliding. Avery stood at the back corner of the bay where she could see the whole field without blocking anyone. She had not been assigned a dramatic role in the room. On paper, she was exactly where Calloway wanted her. Off to the side. Task support. Hands ready, voice quiet. The problem was that she was seeing too much. Her eyes did not move randomly. They tracked pattern. Luke's chest rose unevenly. The right side expanded and fell with effort. The left side lagged behind it, tight and resistant, as if something deeper than fluid was stealing space. The skin at the base of his throat tugged inward with every breath. His lips were darkening at the edges. The line of his neck caught her attention first. The veins were thick, more prominent than they should have been in a man losing this much blood. She looked at the monitor. The heart rate was fast, but the waveform looked thin, starving. The pulse pressure was narrowing. There was blood loss, yes, but there was something else. Something mechanical. Something constricting. Calloway was already on the path his training and confidence liked best. Chest tube tray. Left side, get blood here now. Prep for rapid sequence intubation. I want him controlled before he spirals. Denise turned toward the trauma cart. Blood bank is sending O negative. Luke coughed, and a thread of red bubbled at the corner of his mouth. The resident at his chest glanced up. There's crepitus around the wound. Could be air, could be blood, Calloway said. We decompress first. Avery stepped forward 1 pace. Not enough to challenge him visually. Just enough to enter the sound of the room. Doctor. Calloway did not look at her, no. Avery kept her eyes on Luke. Look at his neck. That got his attention, though, not the kind she needed. I said no. Stay on tasks. Listen to the heart again. The resident hesitated. Calloway cut in before he could move. There is blood in a chest trauma nurse Wells. We know that. Avery's voice stayed low, not like this. Nina glanced up from the pressure cuff. Denise looked from Luke's neck to his monitor and back. Not convinced yet. Not unconcerned either. Calloway moved to the chest tube kit, anger sharpening his motions. Prep him. The resident tore open the sterile drape. The respiratory therapist adjusted the oxygen mask and murmured at Luke to keep breathing, though whether Luke heard any of it was impossible to tell. His eyes fluttered once under half-closed lids. Avery shifted to his right side, close enough now to hear the quality of the sounds under the room. Luke's breathing was not just labored, it was trapped. She leaned slightly toward his head and watched the line of his jaw with each inhalation. Too much effort for too little chest rise. She looked again at the veins in his neck, the falling pressure, the fast, starved rhythm, the blood soaking the left dressing. Calloway held out a gloved hand, scalpel. A scrub tech passed it over. Avery spoke again, clear enough this time that the resident heard every word. Penetrating cardiac tamponade. Silence did not fall exactly, but something in the room tightened around the phrase. The resident blinked. Beck's triad. Calloway's head snapped up, no. Avery did not change volume. Hypotension. Jugular venous distension. Muffled heart sounds. Muffled because it's a trauma bay, Calloway shot back. Because there are 6 people talking and the man is filling his chest. Avery looked at Luke's face. His heart can't fill. Calloway gave a short laugh with no humor in it. You are not diagnosing my patient. No, Avery said. I'm naming what's killing him. The line landed harder than anyone wanted it to. The resident looked down at Luke and then back to Calloway. Should we get ultrasound? Calloway's expression hardened. We do not wait for imaging while he crashes in front of us. He's right about that, Avery said. Calloway took a step toward her. Then stop talking. For a moment, only the rain and monitor sounds filled the gap between them. Avery did not move back. She did not raise her chin. She simply stood there with the same stillness that had unsettled him earlier in the supply room. Nina swallowed and tightened the blood pressure cuff again. Pressure 78/40. Calloway turned away from Avery and cut into the left chest with the fast aggression of someone forcing certainty through his hands. Blood welled immediately. Dark. Heavy. The resident widened the incision. The tube advanced. Suction hissed. The canister began to fill. Luke's body jerked once on the bed. The monitor quickened, then stuttered. Avery watched the blood coming through the tube. Not the bright, high-pressure rhythm of a vessel exploding. Not the release of trapped air. It looked like a body emptying itself into the wrong fix. Luke's neck veins did not flatten. His pressure dropped again. Nina's voice came out tighter now. 74/38. The respiratory therapist looked up. He's tiring. I need to tube him now or we lose the airway. Do it, Calloway said. etomidate and succinylcholine. Avery turned her head sharply. He will crash if you sedate him. Calloway rounded on her fury, burning through his face. That's enough. Avery looked past him to the resident. Listen again. The resident did. Stethoscope at the chest. Brow furrowing. He shifted position and tried once more. I think they're distant, he said. Calloway ripped the stethoscope from his hands and slapped it to Luke's chest himself. He listened for less than a second before throwing it aside. Everything is distant. He has blood in his thorax. Luke's eyes opened. This time they found somebody. Not Calloway. Not the resident, Avery. His gaze was unfocused and glassy, but it locked to her face with the thin, desperate instinct of a person searching for one stable object in a room that had gone strange. His lips moved under the oxygen mask. No words came. Avery leaned closer just enough. Stay with me. It was the only thing she said directly to him. He blinked once, slow and heavy, and then his eyes drifted again. Calloway nodded toward the airway meds. Push. Nina froze with the syringe in hand. Her eyes flicked to Avery, then to Denise, then back to the doctor. She was not experienced enough to challenge him openly. She was experienced enough to know the air in the room had turned dangerous in a different way. Avery saw the hesitation and gave Nina the smallest shake of her head. Calloway caught it. His voice rose. Nurse Parker, push the medication. Denise spoke for the first time since the diagnosis landed. Trent. He turned. What? Denise's eyes were on Luke's neck now, on the pressure trend, on the monitor. She was not ready to overthrow the attending in his own trauma bay. She was also no longer at ease. Take one more listen. Calloway stared at her in disbelief. You too. Denise held his gaze. Take one more listen. That was the nearest thing to a public challenge he had probably heard from her in years, and it hit him like insult. He snatched up the stethoscope again, slapped it to Luke's chest, and listened. 1 beat, 2, 3. His jaw flexed, but pride reached the conclusion before reason could. Tube him. Nina looked sick. The respiratory therapist took a breath, trying to decide whether to obey speed or judgment. Avery stepped in one pace more. This time everybody saw it. Number. The word was not loud, but it cut cleanly through every other sound. Calloway stared at her. What did you say? Avery met his eyes. No sedatives. You are a nurse. Yes. The answer had no apology in it. And you're about to stop practicing medicine in my room. Avery's face did not change. You are about to steal his last blood pressure. Something in the resident gave way. Doctor, if it is tamponade, then positive pressure ventilation could make him worse. Calloway turned on him so fast the resident physically recoiled. Have you all lost your minds? Luke's monitor chirped a sharp warning tone. The waveform began to fray. Nina's voice broke. Pulse is getting thready. The respiratory therapist looked at the screen, then at Luke. We're losing him. Fluids wide open, Calloway barked. Already running, Denise shot back. The blood arrived. A cooler slammed onto the counter. A tech ripped it open with shaking hands. Dark red units emerged into the white light, impossibly ordinary, looking for something carrying that much urgency. Luke's chest heaved once shallow and ragged. Then again. Then not as far. Avery did not watch the panic. She watched the mechanics. The veins, the pressure, the color around his mouth. This was not abstract for her. It was not a differential diagnosis on a board exam. It was a shape she had seen before under different lights in louder rooms with worse air and less time. Men whose blood had nowhere to go because the heart that should have filled was trapped in its own suffocation. The body lied if you let the wrong clues talk louder than the right ones. Calloway held out his hand again. Laryngoscope. The respiratory therapist hesitated just long enough to be noticed. Then Luke's rhythm broke. A jagged run of ventricular ectopy ripped across the screen. Fast, chaotic, wrong. Hold up, the resident said, rhythm change. The monitor screamed. Ventricular fibrillation. Everything after that moved too quickly and too slowly all at once. No pulse, Nina said. Calloway snapped into the code he knew how to run. Start compressions. Charge to 200. Move, move. The resident climbed onto the step stool and began chest compressions. Luke's body jolted under the force. The sound of ribs taking pressure hit the room with a dull, terrible honesty. The defibrillator began its rising whine as energy built inside it. Avery stepped closer to the bed. Calloway saw her and jabbed a finger toward the door. Security. 2 officers appeared at the trauma bay entrance. They had arrived when voices rose and now stood frozen by the sight of a bloody ranger, a code in progress, and a doctor looking half enraged, half afraid. Remove her. They did not move. Not because they were defying him, because nobody in that room quite understood what they were seeing anymore. Luke's rhythm flickered. Coarse at first, then thinner, then gone. The screen flattened into one long line. Flatline. The sound filled the room. Harsh, continuous, inhuman. For a fraction of a second, nobody moved. Even Calloway seemed struck dumb by the finality of it, as if he had expected the monitor to negotiate. Then he found his voice again. Resume compressions, clear for shock, now. The resident bent to start again. Avery reached out and put one hand on his shoulder. The pressure of it stopped him more effectively than shouting would have. No, she said. Calloway's face flushed dark. Get your hands off him. Avery looked at the dead line on the monitor, then at Luke's chest, then at Calloway. Compressions will not fill a heart that cannot expand. Calloway took a step toward her. You do not make that call. You already did, Avery said. Wrong. Denise inhaled sharply. Nina's hands were shaking so badly she had to lock her elbows to steady the crash cart drawer. The resident looked trapped between 2 versions of medicine, and too young to know which one would destroy him if he chose wrong. Calloway's voice cracked at the edges. This is a code. We follow protocol. Avery's answer came back cold and level. Protocol is not oxygen. It is not blood. It is not space around the heart. Denise looked from Avery to Luke, and something in her face changed. Not understanding everything. Understanding enough. Trent, she said quietly, listen to her. That was the moment everything Calloway had built his authority on started to slip. He heard mutiny where there was really fear. Heard disrespect where there was really time running out. Heard a nurse and a charge and a resident and maybe even the room itself refusing to orbit him anymore. He turned searching for somebody to restore order. Security, administration, the invisible weight of the white coat, anything. Nobody came to rescue him from the truth sitting in front of him. Luke lay motionless under the lights, blood-soaked and open to the chest tube that had not solved the thing killing him. The flatline screamed on. The left side of his thorax was a mess of soaked gauze and dark output. His neck veins still stood there obscene in their persistence. Even dead, his body was teaching the diagnosis if somebody would look. Calloway jabbed a finger toward Avery again. You are done here. Fired. Do you understand me? Avery did not answer that. Her eyes moved once over the instrument tray. Fresh gloves, scalpel, retractor, trauma shears, suction. In her head, the room did not sound like a civilian emergency department anymore. It sounded like steel tables under portable lights, air thick with dust and copper. Somebody shouting for blood. Somebody else shouting that there was no more. A generator whining outside canvas walls. Hands inside a chest because there had not been time for permission then either. She came back to the present without any visible sign she had left it. Nina saw the change first. It was not bigger movement, not louder breath. It was the opposite. Avery went very still, and that stillness had weight. Nina whispered before she understood why. Oh my God. Calloway heard it and misread it entirely as fear. He reached for the clock on the wall, clinging to ritual like a life raft. Time of death 153. Number. The word came out of Avery calm enough to make the room freeze again. Calloway stared at her stunned. What? Avery extended her hand without looking away from Luke. Gloves. Nina's body moved before her mind caught up. She grabbed a fresh pair and slapped them into Avery's palm. Calloway made a sound somewhere between outrage and disbelief. "Have you all lost your damn minds?" Denise took one step toward the bed. Not to stop Avery. Not yet to help. To witness. The resident climbed off the stool, breathless and pale. Avery pulled on the gloves with smooth economy. "Doctor," the resident said to Calloway, voice weak. "If she's right, then external compressions won't do anything." Calloway rounded on him. "She is not a surgeon," Avery answered without heat. "No, I'm not a nurse tonight either." Nobody knew what to do with that sentence. The Flatline kept screaming. One of the security officers glanced at the other. The older one swallowed and shifted his stance like a man who had just realized this was no longer a workplace dispute he could solve by escorting someone to the hall. Calloway lunged verbally one last time. "Touch that patient and I will have you arrested." Avery looked at him then. Really looked at him. There was no anger in her face, no triumph, no fear, only a terrible clarity that made Calloway seem smaller than he had 5 seconds earlier. "He is already under arrest," she said. "By physics." The line hit every person in that room differently, but it hit. Denise Rowe moved first. She turned to the older security officer. "Hold the door." The man blinked. "Ma'am, hold the door." Something in Denise's tone made him do it. He stepped in front of the threshold and blocked the line of sight from the hall. Calloway stared at her as if she had betrayed the Republic. Nina's face had gone pale, but her hands steadied. Fear was still there. So was decision. Avery reached toward the tray. The steel reflected the trauma lights in thin, hard lines. Her fingers closed around the scalpel handle. Comfortable. Familiar. No hesitation in the grip. Rain hammered the windows on the far side of the department. Somewhere beyond the curtain line, a child laughed at a cartoon on a waiting room tablet. Somewhere else, somebody yelled for blankets. The whole hospital kept living around this one impossible square of time. Luke lay beneath it all, silent and gray. One ranger's body balanced on the edge between a civilian code and a battlefield procedure nobody in that room should have been about to witness. Calloway stepped forward, voice rising, losing shape. "You are not qualified. You are not privileged. This is insane." Avery set her left hand against Luke's chest and found the landmark with fingers that knew where ribs opened and where seconds disappeared. Her voice, when she spoke again, was quieter than his and carried twice as far. "Then stop wasting mine." Nina stared at the scalpel in Avery's hand. Denise stared at Avery's face and saw finally what had never belonged to a clinic nurse from Puyallup. Not just skill. Not just trauma experience. Something harder. Something forged. The resident whispered it before he meant to. "Who are you?" Avery did not answer. The monitor screamed its straight, unwavering line. Calloway took another step, but this time even he knew he was too late. Avery lifted the scalpel and said no. No one reached her in time. The first cut was clean. Not wild, not hesitant, clean. Steel crossed skin and muscle in one controlled line along the left side of Luke Ryland's chest, and for a split second the entire room seemed to forget how to breathe. Blood welled dark and immediate, and the smell rose hot into the air, copper and salt, and something older than the hospital around it. Nina made a sound that caught high in her throat. The resident stumbled back half a step. Calloway lunged forward with a hand out as if he could stop what had already happened. Avery shifted just enough that his fingers caught air. There was no wasted motion in her body, no panic, no fury. She moved like someone who had crossed this distance before under worse conditions and louder skies. "Suction," she said. Nina did not think. She grabbed the suction tip and slapped it into Avery's waiting palm. Calloway stared at her as if she had struck him. "Nurse Parker, stop." Nina's face had gone white, but her hands did not leave the tray. He was dead. The words came out before she could measure them. That landed in the room, too. Avery widened the incision with trauma shears, cutting through intercostal tissue with fast, precise snips. The older security officer at the door did not move. Denise Rowe stood at the edge of the bed, eyes locked on Avery's hands with the stunned concentration of someone watching a thing she knew she would never forget. The younger security officer looked like he wanted to leave and could not make his feet obey. Avery set the rib spreader with practiced certainty and turned the crank. Bone protested. The chest opened. Air changed. Every person in the room felt it. Not in some mystical way. In the blunt, physical fact that inside the body there was now a cavity, where there had not been one, blood where there should not have been blood, and a view of damage none of them had expected to see in a civilian trauma bay at nearly 2 a.m. Avery leaned over the opening, eyes narrowed suction clearing the field in quick strokes. Blood pooled and vanished into the tubing. Under the lights, tissue shone slick and dark. She worked through it with the concentration of someone reading a language most of the room did not speak. There, she said. Her voice had gone quieter now, not because the urgency was less, but because certainty had replaced argument. The pericardium bulged tight and distended, bruised and dark with trapped blood. The heart beneath it was compressed into a desperate stillness. Avery looked once at Denise. Tamponade. Denise exhaled through her nose, almost a prayer and almost a curse. Calloway found his voice again from somewhere behind outrage and disbelief. If you cut that and he bleeds out, that is on you. Avery did not turn her head. If I do not cut it, he stays dead. She lifted the pericardium with forceps and made a careful opening. Dark blood spilled free in a heavy rush. Pressure released. The trapped sac deflated. Under her hand, Luke's heart fluttered. Weak, ugly, real. Nina's knees nearly gave out. It moved. Avery did not look up. Epinephrine. Denise was already at the crash cart. Drawn. Nina took over without instruction. Pushing now. Avery slid one gloved hand deeper into the chest cavity and began internal cardiac massage, direct and rhythmic, her palm, guiding the heart through movement, the way an engine might be coaxed to catch again if the mechanic knew exactly which part still wanted to live. There was nothing theatrical in the motion, nothing reverent. It was brutal, intimate work, tender only in its precision. The monitor stayed flat for one endless second, then another. Calloway looked at the line and tried to seize control of the room through volume. Time of death has already been called. Stop this. Stop this now. Avery kept compressing. The room stopped hearing him. The resident stood at Luke's head with both hands hovering helplessly above the airway equipment. His whole face had changed. The certainty drilled into him by hierarchy had cracked open, and through it something rawer was showing. His eyes were on Avery's hand around the heart. Should I intubate, he asked, not to Calloway. Avery listened to the rhythm beneath her hand and answered without looking up. Not yet, do not steal preload. Bag gently if you must, do not flood him with pressure. The resident nodded before he even realized he had obeyed her. Denise looked toward the blood products. I need units in him now. A tech fumbled the spike in shaking hands. Nina took it from him, snapped the tubing into place, and hung the unit. Her fingers were slick with sweat inside the gloves. She wiped them once on her scrub leg, then hated herself for noticing she had done it. Calloway took a step toward the bed again, but stopped when Avery lifted her gaze at last. She was spattered with blood now, a fine mist along her cheek, a dark smear across the front of her borrowed navy scrubs. Her hair had not loosened, her breathing had not changed. Under the lights, her eyes looked stripped down to function. Call surgery, she said. Calloway's mouth opened. She spoke over him. Call Dr. Adrian Kessler. Tell him he has a penetrating cardiac injury with return of contractility after emergency thoracotomy. Tell him I need an operating room now. No one in that room had authority to do exactly what she was doing, but every person there understood instinctively that the sentence itself carried authority. The monitor gave one isolated beep. Nina froze. Another beep followed it. The straight line twitched into electrical activity. Pulse. Denise said, fingers at Luke's carotid. I have a pulse. The room exhaled all at once. It did not sound triumphant. It sounded like oxygen returning to a place that had been clamped shut. Calloway stared at the monitor in naked disbelief. That is not possible. Denise did not bother looking at him. And yet, Avery kept one hand around the heart for 2 more beats, feeling for strength, feeling for volume. The pulse was there, but thin. Blood pressure began to climb by inches, not enough to trust, only enough to work with. Pressure 86 systolic, Nina said, voice shaking. Avery's other hand moved deeper, feeling past the heart for the descending aorta. When she found it, her fingers compressed it against the spine, redirecting flow to the brain and myocardium, the way habit and anatomy had taught her long before Harbor Ridge had learned her fake name. The resident stared. What are you doing? Buying him time. That is not an ER procedure. Avery gave a hard little breath through her nose that might have been almost a laugh in another life. Then let surgery complain. She looked up at Denise. Move the blood faster. Pressure can live in the 80s for a minute. It cannot live in the 50s. Denise nodded once. Done. The younger security officer at the door finally found words. Should we call somebody? Denise turned on him with the rough authority of a night-charge nurse who had crossed the line past patients. You are somebody. Hold that door and keep anyone without gloves out of this bay. He swallowed. Yes, ma'am. Calloway stood rooted beside the tray white coat flecked with Luke's blood and his own relevance bleeding out under the lights. He still looked like a doctor. But the room had stopped arranging itself around him. Orders were moving past him now around him from a woman in navy scrubs with one hand inside a ranger's chest. He tried one last time to reclaim ownership of the event by naming the risk. This is criminal. Do you understand that? This is a felony. Avery did not glance up. Then call the police after he gets upstairs. Denise reached for the phone with blood on her gloves and snapped at the unit clerk for a clean receiver. The clerk stood frozen, then moved all at once. The call to the operating room went out. The call to Kessler went out next. Word traveled faster than charting ever did in a hospital. Within 30 seconds, half the emergency department knew there was an open chest in Trauma 1. Outside, the bay faces appeared and vanished. A transport tech, a respiratory therapist from another zone, a resident from internal medicine who had no business being there. The older security officer used both forearms to keep them back. Inside, the air had gone electric. Avery maintained control and spoke in short, clinical bursts. Pack here. No, not there. Suction again. Keep the field clear. More light. I need a second line to run faster. Do not let the tube kink. Every instruction was exact. Every one landed on the right target. Even the resident who had resisted the longest found himself obeying before he had time to decide whether he should. Nina looked from Avery's hands to her face and saw it clearly now. This was not adrenaline, not luck, not a desperate gamble from somebody pretending. Avery was operating in a place that terrified everyone else because she had lived there long enough to stop wasting fear on it. The elevator ride never became a question. When the transport bed arrived, there was only the practical horror of how to move a man with an open chest and a hand still inside him. Avery climbed onto the mattress beside Luke without being asked. One knee braced near his thigh. One forearm anchored. Her left hand kept control of the heart and aortic flow, while the rest of the team converted the trauma bed into a moving operating field as best they could. You cannot ride with him like that, one of the transporters blurted. Avery looked at him not unkindly. Do you want him alive when we reach the elevator? The transporter shut his mouth. They rolled. The wheels thundered over the seams in the floor. The ER split open ahead of them, staff flattening against walls, patients staring from curtains and hallway stretchers. A mother covered her child's eyes too late. A man in a cervical collar turned his head and went pale. Somebody pulled out a phone. Denise barked at them to put it away, but not before a shaky rectangle of bright screen caught the image that would be halfway across Tacoma before the blood on Avery's hands was dry. The image was simple enough to travel. A woman in navy scrubs riding a bed with her hand inside a soldier's chest. The elevator doors opened. They packed in too close, the air too hot and metal-smelling. Luke's monitor beeped thinly, then stronger, then thin again. Avery never looked away from him. The resident bagged the airway gently. Nina held blood high and watched the chamber like if she blinked, the flow would stop. When the doors opened onto the surgical floor, the operating room team was already waiting. Clean light. Better instruments. Faces behind masks that knew exactly how wrong the incoming scene was. Dr. Adrian Kessler entered from the scrub area, half into a gown, hair damp at the temples, eyes still sharp from being dragged out of another problem into this one. He was not handsome in a polished way the way Calloway tried to be. Kessler looked like a man built by long nights and unforgiving anatomy. Nothing decorative survived long on his face. Competence did. He took one look at the bed coming toward him and stopped dead. The open chest, the packed field, the blood. Avery still inside the patient, alive by inches. For half a second, the room held on that image. Then Kessler moved. Who did this? No one answered immediately. Not because they did not know. Because the truth had become difficult to say aloud. Avery transferred her gaze to him for the first time. Penetrating cardiac tamponade. Pericardium vented. Internal massage got us ROSC. I have temporary aortic control. He's unstable and still bleeding. Kessler stared at her over his mask. The language was not wrong. Not imprecise. Not stolen from television or memory. It was the language of someone who lived inside that level of decision-making. He looked down at the field again. The release cut was clean. The structures had been respected. There was nothing sloppy in what he saw. Nothing lucky. Where's the injury, he said. Avery indicated with 2 fingers. The scrub nurse suctioned. Blood cleared enough for Kessler to see the wounded ventricle and surrounding damage. His eyes narrowed. Jesus. Calloway had followed the bed up and was already talking voice too fast, trying to seize the narrative before it settled on the floor. She interfered with the code. She assaulted staff. She performed surgery without privileges. This was a total collapse of protocol. Kessler did not look at him. Step out of my field. Calloway blinked. Adrian, listen to me. I am looking at the result. That shut him up for exactly 2 seconds. This hospital will be liable for everything that happens from here. Kessler's gaze stayed on the heart. He has a pulse. He could still die. He was dead. Kessler scrubbed in with furious speed, and when he stepped into the field, Avery did not posture or cling to the center. She gave a concise handoff, pressure points, blood loss estimate, likely ventricular injury, chest tube output pressure trend. Kessler listened because there was no room not to. The anesthesiologist took over the airway and lines. The scrub nurse snapped instruments into waiting hands. The room became what operating rooms became at their best. A machine of trained people choosing the patient over ego. Only then did Avery ease her control enough for Kessler to take the heart from her hands. Her forearms burned the moment she let go. She stepped back 1 pace. For the first time since Luke had crossed the ER threshold, the night caught up with her body. Not in shaking. Never that. In weight, in the dull heaviness behind the ribs that came after danger, when adrenaline no longer covered every crack. Kessler worked fast and clean. Clamp, suture, suction, pressure, repair. The right ventricle accepted the stitch with the reluctant delicacy of damaged tissue that still wanted a chance. The anesthesiologist called out numbers. Pressure, 92/50. Rhythm, sinus tach. Good, Kessler said. Calloway stood at the edge of the room, useless and furious, splashed with blood that no longer seemed to confer anything at all. He watched Kessler rely on the anatomy Avery had opened, and the time she had bought, and the truth of that stripped something off him layer by layer. When Kessler finally glanced up, it was at Avery. Who are you? Avery peeled off one outer glove and looked down at her raw hands, pink, where she had scrubbed them too hard hours ago, and slick again now with someone else's blood. A nurse on nights. Kessler's eyes stayed on her face. Number. Before the question could go any farther, the operating room doors opened, and hospital administration arrived with fear dressed up as process. Franklin Shaw, the overnight administrator, wore a suit that had not been meant for this hour, and now looked damp and defeated around the collar. Beside him stood legal counsel with a tablet already open and a face arranged into alarm. 2 uniformed officers hovered behind them, summoned by somebody downstairs who had heard words like unauthorized procedure and assault. Shaw took in the blood, the open chest, the active repair, and flinched the way civilians always did when medicine stopped looking clean enough to call professional. What happened here? Nobody answered him. Kessler did not even break concentration. If you are not sterile, you are decorative. Move. Shaw reddened. We have a serious legal problem. Kessler tied a stitch. You had a serious mortality problem. Legal counsel lifted her voice slightly. The physician on record is Dr. Calloway. At that, Kessler finally looked up. He looked from the counsel to Calloway, then to Avery, and something in his expression went from irritation to a colder recognition. The physician on record nearly lost him. Calloway snapped. I was running a code. Kessler answered flatly, badly. The officers did not know where to put their eyes. One fixed on the floor. The other tried to study Avery and failed because every time he looked at her hands, he looked away again. Luke's heart kept beating. Weakly, supported, but beating. The entire argument in that room shrank before that stubborn fact. Kessler finished the immediate repair, placed temporary packing where he needed it, and gave the first steady exhale the room had heard from him. Transferred to ICU when anesthesia clears. He is not out of danger. Avery nodded once. He wasn't when he came in. Kessler looked at the sutures one more time at the line of the release at the spacing, then back at her. You did not learn that in nursing school. No, Avery said. Nothing more. That was enough to shift the air again. By the time they rolled Luke to the cardiothoracic ICU, the story had already escaped the walls. It moved through the hospital first. Fast and shape-changing. The new nurse cut open a soldier in the ER. The new nurse saved a man no one else could. The new nurse lost her mind. The new nurse was military. By the time those versions reached the waiting room, they had met phones, and weather, and boredom, and the public hunger for the most vivid possible thing. The shaky video from the corridor was already online. The angle was terrible. The sound worse. It did not matter. It showed enough to ignite the city. A blood-soaked bed. A woman in scrubs with command in her posture. Staff moving around her like gravity had changed. By the time Luke reached ICU Harbor Ridge's front lobby was no longer simply a hospital lobby. It was becoming a scene. Avery stepped out of the ICU room after the transfer, while respiratory settled the ventilator and Kessler reviewed the immediate post-operative plan. Her scrubs were stiffening where blood had dried. The back of her neck ached. Her hands had started to throb in the quiet, once work shifted from impossible to merely critical. Nina found her near the sink alcove outside the unit. For a second, the younger nurse just stood there looking at her as if the woman she had shared burnt coffee jokes with 3 hours ago had been replaced by somebody cut from a different material. You saved him, Nina said softly. Avery turned on the faucet. He is not safe yet. Nina watched the water run red over Avery's fingers. That's not what I meant. Avery did not answer. Nina swallowed. Police are downstairs. Yes. Administration is saying they might have to suspend you before sunrise. Avery scrubbed under each nail with disciplined attention as if her skin itself were another instrument to be reset. Probably. Nina stared at her reflection in the stainless steel soap dispenser. How are you this calm? Avery looked at the water, not at Nina. Because panic is late. The words sat between them. Nina almost asked the question that had been burning holes in her since the thoracotomy. Who are you, really? Instead, she heard footsteps approaching fast and turned. Calloway. His face had changed. Not softened, not humbled, stripped. The polished edges were gone. In their place was the brittle, bright rage of a man who knew the room had seen him fail and could not survive that fact unpunished. This is not over, he said. Avery shut off the faucet. No, he mistook agreement for surrender. You cut open a patient in a civilian emergency department. You are done. Do you understand me? Done. Avery dried her hands. You should be with your charting, she said. He stepped closer. I'm going to press charges. You should do what helps you sleep. For the first time, her calm made him lose control completely. You think because he got a pulse back, this goes away. You think one freak miracle means you get to make medicine up as you go. Avery's eyes lifted to his. It wasn't a miracle. The force of that sentence stopped him harder than any insult would have. Then she walked past him. The two officers downstairs were waiting when she reached the ER again. One female, one male. Both local. Both wearing the tense, over-careful expression police wore when stepping into institutional territory where uniforms stopped meaning the same thing they did on the street. Franklin Shaw hovered beside them with legal counsel and a face shiny with stress. The waiting room had gone louder in the last 20 minutes. Phones out. Visitors whispering. Several patients openly watching. The wall-mounted television above the vending machines now carried a local news teaser about an emergency incident at Harbor Ridge Medical Center. No details yet, just enough to poison the air. Officer Maya Bennett stepped forward. Ma'am, are you Avery Wells? Avery stopped at the nurse's station. Yes. Can you come with us to answer some questions regarding an incident in Trauma 1? Calloway arrived 2 steps behind her like a man determined not to miss his own revenge. It was assault and unauthorized surgery. She interfered with the physician. My resident can testify. The resident in question, still pale and hollow-eyed, had come down from the OR after handoff and now stood near the wall listening to the doctor he had been trained to obey and the truth he had seen with his own eyes. He did not speak. Denise Rowe folded her arms. He can also testify that she got a pulse back. Shaw swung toward her. Denise. Denise did not blink. Franklin. Officer Bennett looked from one face to another and decided procedure was the only safe language left in the room. Ma'am, I need you to come with us. Avery's gaze moved once across the room. The waiting families. The registration desk. The TV. The blood on her own sleeve she had not yet changed out of. Then, to a point beyond all of them, somewhere through the rain-dark glass. One call first. Officer Cole Ramirez shook his head. You can make a call at the station. Avery reached into her pocket. The phone she pulled out did not look like the hospital owned it, and did not look like something a quiet float nurse should have been carrying. Matte black. Minimal. Utilitarian. No bright case. No personal sticker. It looked built for signal in ugly places. Calloway saw it and frowned. What is that? Avery did not answer him. She dialed from memory. When the line connected, the change in her voice was subtle and total. This is Sloan, she said. I'm burned. Harbor Ridge Medical Center, Tacoma. Army Ranger survived. I acted. Every face around her shifted. She listened. Her eyes stayed steady. Yes, she said. Legal and containment. Now. Then she ended the call and slipped the phone back into her pocket. The silence afterward felt larger than the ER. Officer Bennett was the first to recover. Sloan is your last name. Avery did not correct her. Shaw took one uncertain step back. What exactly is going on? Calloway laughed once thin and ugly. Oh, now we get spy games. Denise looked at Avery with new focus old instincts rearranging themselves around something she had suspected but never named. Nina looked like she had just realized the night was bigger than a hospital scandal, and did not know whether that helped or made everything worse. Avery spoke without raising her voice. Lockdown, Trauma 1. No one goes in without authorization. Shut the ambulance side doors unless EMS is actively incoming. And if anybody asks for copies of charting those, do not leave this desk without legal. Shaw sputtered. You do not give orders here. Denise picked up the security phone and started giving them anyway. That was when the elevator doors at the far end of the corridor opened. 4 men stepped out in dark suits that did not belong to patient's family or administration at this hour. Their shoes were dry despite the weather outside. Their eyes moved over the department with a speed and discipline that made half the room lower its voice before they had crossed 10 feet. The lead man wore no expression a civilian could read quickly. Lean, close-cut hair, pale scar through one eyebrow. He walked straight toward Avery as though everything else in the ER were furniture. Officer Bennett moved to intercept out of reflex. "Sir, this area is restricted." The man produced credentials in one smooth motion. She read them. Her posture changed by degrees she would later deny. Franklin Shaw stepped in because fear and bureaucracy often made the same mistake. "Who are you people?" The man looked past him to Avery. "Dr. Sloan." Calloway laughed again, but there was no conviction in it now. "Doctor." The man's gaze flicked to Calloway for less than a second. "That's enough from you." Calloway actually stopped talking. The effect of that on the department was immediate and almost obscene. The man turned back to Avery. "Grant Voss, Department of Defense." The words landed with an audible shift in the room. Nina's eyes widened. Denise went very still. Shaw looked like somebody had quietly informed him the building was no longer entirely his. Officer Ramirez frowned. "This is a civilian hospital." Voss nodded once. "And currently the site of a protected military casualty with a compromised chain of events." Calloway found his voice in fragments. "This woman is a nurse." Voss looked at him again, and whatever Calloway saw there stole the rest of the sentence. "No," Voss said, "she isn't." He reached into the inner pocket of his jacket and produced a slim folder. He opened it, checked the photo once, and then looked up at the woman everyone had known as Avery Wells. Lieutenant Colonel Dr. Avery Sloan. No one moved. The title hung in the fluorescent air beside the smell of antiseptic and blood. Nina stared at Avery. Denise let out the smallest breath and did not seem surprised so much as confirmed. Officer Bennett's hand fell away from her belt. Shaw's legal counsel looked from Voss to Avery to the still damp phone in Avery's pocket and suddenly understood that every script she had prepared for this night was now worthless. Calloway's face emptied. "Number?" Voss did not even spare him patience enough for contempt. "Former Special Operations Combat Surgeon. Current status restricted." Shaw swallowed. "You mean we hired a lieutenant colonel as a temporary ER nurse?" "You hired the paperwork that reached your HR system," Voss said. Avery stood in the center of it all without trying to own the moment. That was the most unsettling part. She looked tired. Blood dried on her collar. Her hands were scrubbed raw. She looked like somebody who had just done the one thing she had hoped not to do and had no interest in applause for it. Kessler stepped out of the stairwell, then having handed ICU over to his team for the moment. His eyes went straight to Voss, then to Avery, then to the faces around the station. "So it's true." Voss glanced at him. "You're Dr. Kessler. I'm the one who finished the repair." Voss gave a short nod. "Then you know what she did." Kessler looked at Avery for one long second. "Yes," he said, "I do." The television above the waiting room changed from teaser to live broadcast. A local anchor now stood in a studio with the headline stretched below him in red and white. "Emergency surgery. Incident at Harbor Ridge." A blurred, still image filled the screen behind him. Even blurred, the outline was obvious. A woman in dark scrubs over an open chest. The waiting room murmured as one body. Shaw turned toward the television like a man watching his hospital combust in real time. "Turn that off." Nobody did. Voss kept his eyes on Avery. "We need a room." Officer Bennett found enough voice to ask the practical question. "Is she under arrest?" Voss answered carefully. "Not by you." Calloway erupted. "This is insane." Kessler's voice cut cleanly across him. "He has a pulse because of her." Calloway spun toward him. "You cannot defend this." Kessler looked back with the blunt calm of a surgeon who no longer needed the ER physician to matter. "I don't need to defend it. I can see the sutures." That ended the argument in every way that counted. Voss nodded toward the administrative conference room corridor. "Now." Avery looked once toward the ceiling, toward the floors above where Luke Ryland lay sedated and bandaged and alive on lines and sutures and blood, and the small margin she had carved out for him with steel. Then she followed Voss. Behind her, the ER kept moving because it had to. A chest pain in bed 3 still needed an ECG. Mrs. Delaney in 12 still needed her scan result explained. The man with abdominal pain in 9 still needed somebody to come back and decide whether his appendix was buying him surgery before dawn. No story, no matter how large, ever fully interrupted the work. That reality settled over Denise Rowe like armor. She picked up the trackboard marker and began issuing assignments. Nina stood still 1 second longer, eyes fixed on the empty space where Avery had been, then grabbed the ultrasound cart someone had left in the hall and rolled it toward bed 3. At the edge of the department, the television kept talking. In the conference room upstairs, wet coats and polished shoes crowded around a scarred laminate table, while legal language tried to catch up to a night it had no categories for. Voss stood by the door. Kessler remained because he would not let administrators describe his patient without him. Shaw sat and sat again. The local officers hovered near procedure. Calloway pushed his version of events too hard and too quickly. Avery stayed on her feet, arms loose at her sides, blood on her cuffs, face unreadable. When Voss slid a military ID across the table, Kessler was the first one besides Avery to touch it. The picture was younger, harder, same eyes, same impossible stillness. Below it in black print, the name read plainly enough for the whole room to feel it. Lieutenant Colonel Avery Sloan. Nobody in Harbor Ridge had hired Avery Wells. They had only borrowed her. Borrowed was the right word. It hung over the conference room harder than the rain striking the windows 2 floors below. Franklin Shaw sat with both palms pressed flat on the table, as if he could steady the building through laminate. The legal counsel beside him had finally stopped pretending the tablet in front of her could solve what had happened downstairs. Officer Maya Bennett stood near the wall with her notebook still out but unwritten in. Cole Ramirez had shifted into the posture of a man who knew he had stepped into a jurisdictional maze and was trying not to say the wrong thing inside it. Only Dr. Adrian Kessler looked less surprised with every passing minute. He had seen Avery's hands inside a chest. After that, an old military ID was just another form of anatomy. Unexpected, but consistent. Grant Voss stayed near the door and spoke with the patience of someone who had learned long ago that facts landed harder when delivered without heat. Lieutenant Colonel Avery Sloan was not assigned here through any standard military chain. She chose civilian cover, limited paper trail, no operational footprint that matters to this room. Shaw stared at Avery. You were working in my emergency department under a false identity. Avery remained standing. She had not asked for a chair, and no one had thought to offer one. Blood had dried in a dark curve along her cuff. I was working in your emergency department under the identity your HR accepted. That is not an answer. It is the one you have. Shaw turned to Voss, as if hoping another man's title would make the conversation obey. Why would a military surgeon do this? Voss looked at Avery. Because she wanted to disappear. Nobody in the room said anything for a moment. Kessler was the first to break the silence. People do not disappear into night shift nursing unless they are running from something or trying very hard not to be found. Avery did not look at him. Sometimes both. Maya Bennett's eyes narrowed not with suspicion so much as recalculation. Were we supposed to know any of this? No, Voss said. Shaw let out a short disbelieving breath. That is not helping. Helping is the patient in ICU with a heartbeat. That came from Kessler. His voice had not risen, but it changed the room anyway. He had gone back down to his surgeon's center, the hard place where outcomes mattered more than institution. Shaw rubbed one hand over his mouth. We have a viral video. We have press in the lobby. We have a civilian hospital tied to a military casualty and unauthorized thoracotomy, and now apparently a hidden surgeon in disguise. Voss answered him with a flat look. You have a secure facility problem. We are not a facility. Tonight you are. Avery said nothing. She had gone quieter with every new revelation, not because she was shrinking from the room, but because she was listening to something beneath it. Kessler noticed first. Her eyes had shifted toward the glass wall, toward the floor above them, toward Luke. He followed her gaze. What? Avery's face did not change. The crash details. Shaw frowned. What about them? She spoke slowly now, not searching for words, but arranging them in order. The intrusion line. The angle of entry. It came through the left thorax and upper abdomen. Everyone assumed road debris or structural collapse from the wreck. That seems reasonable, Bennett said. Avery nodded once. For a pile-up. Not for that angle. Kessler's posture sharpened. You are saying it was not random. I'm saying it did not feel like a road, did it? Voss had already pulled out his phone. Explain. Avery looked at the table as if the wound were drawn there. It entered high and drove inward. Not up from the roadbed, not a clean undercarriage breach. More like a forced intrusion from the frame or side structure. Deliberate impact or tampering changes angles. Kessler swore softly under his breath. Bennett frowned. You saw all that in the bay. I saw the wound. Voss stepped aside, spoke into the phone in clipped phrases, listened, and then went even stiller than before. That line of thinking just got expensive, he said. Every eye in the room went to him. He looked at Avery first. State Highway Preliminary called it in as a possible tamper event 15 minutes ago. Front brake line compromised. Steering linkage shows signs of deliberate damage. Shaw stared. You mean somebody tried to kill him before he ever reached us? Voss did not soften the answer. Yes. The room seemed to shrink all at once. The hospital was no longer the place where violence had ended. It was only where it had followed him. Kessler turned toward the door without another word. I'm going back to ICU. Avery moved at the same time. Voss caught the motion and did not stop it. He only fell into step beside her. The corridor outside the conference room felt too bright after the pressure of that conversation. Carpet underfoot. Corporate paintings no one had ever really seen. The hospital's upper floors carried the fake calm of administration and scheduled medicine. But under it, the whole building was beginning to vibrate with rumor. Staff looked up as Avery passed. Some recognized her. Some recognized the dried blood. A pair of respiratory therapists stopped talking mid-sentence. A janitor froze with a trash cart half-turned. Avery did not look at any of them. You knew from the start, Voss said quietly as they walked. No, I knew something did not fit. There is a difference. Kessler pushed through the stairwell door instead of waiting for the elevator. Avery followed. The concrete walls amplified every footfall. Below them, the hospital kept speaking in fragments. Intercom pages. Distant alarms. The low crowd noise from the lobby. It all rose through the stairwell like heat. By the time they reached the ICU level, the atmosphere had changed again. The hallway was dimmer than the ER, quieter in sound, but somehow more tense. Machines breathed softly behind glass. Nurses moved in practiced lines around rooms where people hovered between recovery and collapse. 2 security guards now stood at opposite ends of the corridor, visibly unsure whether they were guarding a patient or trying to guard a situation they did not understand. Luke lay in the third room on the left. Through the glass, his chest rose under mechanical ventilation. Thick, white dressings crossed his torso. Monitors traced out a narrow green rhythm. Not strong, not weak enough to call hopeless. Suspended, Avery stopped at the glass for half a second and read the room the way she had read the trauma bay. Vasopressors hanging. Blood products staged. Sedation stable. Drain output collected and measured. Kessler went inside immediately to check the post-op field. Avery did not follow. Her attention shifted down the hall. The corridor nurse at the station was young and trying not to show how rattled she was by Marines suddenly becoming part of her shift. She glanced up as Avery approached. "Where's your regular security officer?" The nurse blinked. He stepped away. Linen room disturbance on the south end. Avery's head turned. Who called him there? I don't know. Maybe environmental. Her stomach tightened. Bait. Voss saw it in her face. What? Lock Luke's door, now. Kessler heard her through the cracked ICU room door and looked up sharply. He took one look at her expression and moved. Seal that room. Nobody in without me. The nurse at the desk stared. Doctor, what is happening? Avery stepped closer, voice low and flat. Get under the station desk. Do not come out until somebody says my name. The nurse did not argue after that. Fear had become specific enough to obey. Voss spoke into his sleeve mic. All teams ICU corridor, now. The first stairwell door at the far end eased open, not with a bang, with care. 2 men came through wearing scrubs and caps masks over the lower half of their faces, carrying soft black bags that could have passed as medical supply kits to anyone looking with hospital eyes instead of battlefield ones. They walked wrong for staff. Their feet were too deliberate. Their heads moved in short perimeter checks, not in the distracted drift of people navigating patient care. They were not looking for monitors or room numbers. They were looking for resistance. Avery stepped into the center of the corridor before either could get close to Luke's room. Stop. The word was enough to freeze the first man for half a heartbeat. The second reacted instantly, too fast for anything but training. His hand went into the bag. Voss was already reaching for his own weapon when Avery turned hand extended. He drew and passed her the compact sidearm grip first without a wasted syllable. Kessler saw the gun and his face changed. Not in my ICU. Avery did not look at him, then tell them. The second man came out of the bag with a compact suppressed weapon wrapped in blue surgical cloth. Avery fired first. The shot cracked through the ICU louder than it had any right to in that enclosed space. The round hit low in the man's thigh. He folded, with a strangled cry weapon clattering and then being dragged back toward his body with desperate reflex. The first intruder got his own weapon free and fired toward Avery. The rounds punched into the wall where she had been a fraction of a second earlier. Glass exploded from an empty room door. Alarms began screaming. Patients woke. A woman somewhere down the hall cried out in confusion. An IV pump started shrilling. Avery was already moving. She cut across the doorway of an empty patient room and used the wall edge for cover firing once to force the gunman to flinch back. Powder from the shattered drywall drifted through the fluorescent light like dirty snow. The gunman advanced in short, controlled steps, trying to keep pressure on her position. He was not improvising. Neither was she. Her eyes flicked through the room she had entered. Hospital bed. IV pole. Portable oxygen cylinder. Fire extinguisher on the wall. Plastic chair. Nothing made for a gunfight. Everything usable. She grabbed the extinguisher first and ripped it free. Outside in the corridor, the wounded intruder was still trying to reach his dropped weapon. Voss kicked it away and pinned him with a second gun he no longer needed to fire. The first attacker shifted his weight, trying to angle toward Luke's room while still suppressing Avery's cover. She slid the extinguisher low across the floor into the corridor. It spun under the hanging fluorescent lights and clipped the base of the IV pole near the doorway. The attacker fired at movement. The canister sparked. Avery leaned out and put one round into the extinguisher body. It burst in a violent cloud of white powder that flooded the narrow hall. Visibility vanished. The attacker coughed and fired blind into the ceiling. Tile shattered. Dust and suppression powder rolled together into a choking haze. Avery came through it low and fast. She hit him before he reset his stance. Her shoulder drove into his torso. The weapon jerked upward, spitting rounds into ductwork and plaster. She trapped the barrel against the wall with one forearm, swept his legs out with the inside of her knee, and slammed him onto the linoleum. His head struck hard. He tried to rise on instinct. Avery struck once with the heel of the pistol across the side of his skull. He went limp. The whole exchange lasted maybe 6 seconds. It felt longer because hospitals were not built to contain gunfire. Every sound bounced wrong. Every flash of motion looked obscene against the sealed glass and hand sanitizer dispensers and neatly labeled medication drawers. Kessler stepped into the hall only after the firing stopped, and for 1 second he simply stared. White suppression dust coated the floor. Shattered glass glittered under the lights. One attacker lay unconscious. The other was bleeding and breathing in ragged animal bursts as Voss knelt over him with one knee in his shoulder blade. Avery stood in the middle of it all, pistol lowered but ready, chest rising and falling exactly once deeper than before. The monitor inside Luke's room kept beeping. Steady. Alive. Kessler looked at Avery and said the only thing his tired surgeon's mind could find. My ICU. Avery's jaw tightened. Your patient. That reset him. He pivoted toward Luke's room, checked the lines, checked the pressure, checked the drain output, checked the vent. All still holding. His hands slowed only after the second pass. The elevator at the far end chimed. Avery turned instantly, stance set again. The doors opened on a formation that changed the entire hallway before a word was spoken. A tall man in a dark raincoat stepped out first, silver beginning at the temple shoulders, carrying the kind of command that had spent decades making rooms rearrange themselves around it. Behind him came 2 Marines in plain service uniforms, and one more suited security man moving with Voss's same cold economy. General Daniel Ryland stopped dead at the sight before him. Broken glass, powder in the air, an unconscious gunman, another restrained and bleeding. Marines not yet posted but already moving, and at the center 1 woman in hospital scrubs, holding a weapon with the unshaken stillness of someone who had not drawn it for the first time tonight. His eyes found Avery and held. They told me you were gone, he said. Avery lowered the pistol only after checking the elevator corners and the second stairwell entrance. I was trying to be. The general looked past her to Luke's room. Something crossed his face then. Not weakness. Not exactly grief. The hard, private pain of a father forced to absorb the sight of a son surviving on machines. My son. Kessler stepped to him at once. He is alive. Critical, but stable. Do not touch anything sterile around the bed. The general nodded once and moved with surprising care for a man built so much out of command. At the door to Luke's room, he stopped and looked back at Avery. You kept him that way. Avery said nothing. Voss rose and handed the downed attacker to one of his men with a sharp instruction to secure both bodies and clear every bag for secondary devices. Then he crossed to the general. Sir, attempted cleanup team. 2 operators. Likely more eyes on the lobby. General Ryland's mouth hardened. Inside a hospital. Yes, sir. Kessler came back out of Luke's room after the first check. His voice was clipped and furious. He cannot be moved. The general glanced at him. Can you keep him alive here? If no one else tries to finish him, yes. Voss looked down the corridor, mind already building the perimeter outward. The crash was not enough. They wanted confirmation. Avery turned to the restrained attacker. The man's breathing had gone shallow with pain, but his eyes were fully awake now. Calculating. She crouched just enough to look into them. He looked away first. That told her more than bravado would have. Professional, she said quietly. Voss nodded. Not freelancers. The younger ICU nurse finally crawled out from under the station desk, sobbing once before she got control of herself. Kessler sent her back under with more kindness than his voice suggested, and then took the desk phone, barking orders for full-floor lockdown badge access, freeze, no visitors, no movement without face confirmation. Within minutes, the hallway filled with a controlled response. Local officers arrived, first breathless and out of depth, then more federal support, then hospital security trying to act as though this was still somehow on their map of possible shift complications. Maya Bennett came through the stairwell and stopped hard at the scene. Her eyes moved from the intruders to the weapons to Avery's blood-streaked scrubs. Jesus. Kessler answered without looking up from the station logs. That was my exact reaction. Bennett stepped closer to the restrained attacker and then to Voss. Who authorized a firearm discharge in a hospital? Voss held her gaze. I did. She shifted her focus to Avery, and she used it. Yes, Voss said, correctly. General Ryland emerged from Luke's room, then one hand briefly touching the doorframe behind him before he let it go. He did not waste time on outrage. Men at his level learned long ago that outrage was for after control. What was Luke carrying? Voss took one beat, then answered because nobody in that hall still qualified as outside the event. Evidence package. Financial and operational records tied to a defense contractor under federal investigation. Black transfers. Ghost logistics. Possible killings tied to offshore work. He was moving a hard copy chain because digital paths were already burned. The general's face gave away almost nothing, but Avery saw the confirmation in it. He told me it was bad, he said. He did not tell me how bad. He probably thought he had time, Avery said. That brought his eyes back to her. Recognition lived there now, not just of her face, but of the kind of sentence that only came from experience. You know him. He knows me. Kessler, who had tolerated mystery only because medicine had demanded speed, finally let some of his own questions through. From where? Avery looked toward Luke's room again, overseas. Nothing more. Maya. Bennett took that in, then pulled her attention back to procedure. We need evidence preserved, statements, chain of custody on the weapons. You'll have it, Voss said. One of his men approached then with a tablet in hand and spoke low enough that only the cluster closest heard. We pulled hospital entry feeds and local traffic around the time of breach. Also, communications off the physician floor. There's something else. Voss took the tablet. His eyes moved once over the screen and sharpened. He turned it so only Avery, Kessler, Bennett, and the general could see. A text message log, outgoing, from Dr. Trent Calloway's phone. Time-stamped 10 minutes before the attackers entered the ICU. The message was short enough to strike like a slap. She is here. Come get her. Bennett's face emptied. That's probable cause. Kessler went still in a way that looked more dangerous than shouting would have. He signaled them. General Ryland's jaw locked. Avery did not speak for a long moment. Her eyes stayed on the screen. Not because she was shocked he had turned ugly. Because this gave shape to the ugliness. He had not only tried to bury his mistake under policy and outrage, he had reached outward from it. He had made a call into the dark because he would rather risk her life than survive the truth. Voss handed the tablet to Bennett. Find him. Bennett nodded once and turned for the stairwell, already calling it in. In the corridor, white powder still drifted under the vents. Luke's monitor kept tracing its stubborn green line through the glass. The intruders lay restrained on the floor under the hard hospital lights. Kessler stood with one hand on the station desk and blood still under one fingernail from a heart he had repaired after another woman opened the chest first. General Ryland looked at Avery and spoke in a voice low enough that nobody but the nearest few heard. You came back from the dead on the worst night possible. Avery looked through the glass at Luke, not at the general. No, she said, I got recognized. And around them, Harbor Ridge locked down tighter. Not around a story anymore, but around the living proof at the center of it. Recognition changed the building before dawn did. By 3 a.m, Harbor Ridge no longer felt like a hospital trying to absorb one bad trauma. It felt like a structure holding its breath while too many systems collided inside it at once. The lobby had become a whitewashed cage of camera light and security tape. The waiting room hummed with the brittle electricity of rumor. Staff moved faster than usual and spoke more quietly, which in hospitals was often the clearest sign that something had gone very wrong. On the ICU floor, the false calm held only because people were choosing it minute by minute. Avery stood outside Luke Ryland's room with dried extinguisher powder on one sleeve and blood still shadowing the seam of her cuff. She had not put the gun down until Voss himself took it back from her with a glance that said he understood exactly how much it cost to release it. Now her hands were empty again. They did not feel empty. Inside the room, Luke lay motionless beneath warm blankets and thick dressing, sedated, ventilated, held in place by lines and machines, and a repair that still needed the next hour to prove itself. The monitor traced its narrow green rhythm over and over, reliable enough to keep hope alive, fragile enough that nobody in the corridor trusted it fully. Kessler stepped out after another exam and closed the glass door behind him with more care than the movement required. "He is holding," he said. General Daniel Ryland looked at him as though the two words might fail if spoken too quickly. "Holding is not enough. It is what we have at the moment." Kessler's own fatigue had begun to show at the edges now, not in his voice, in the way he rolled one shoulder back once before stilling it, in the faint indentation the surgical mask had left along his cheek. He turned to Avery. "You should sit, number." That was not a request. It was not an order either. For 1 second he looked like he might push. Then he took in her face properly. The exhaustion there was real. So was the refusal. He let it go because surgeons knew when force would only damage useful things. Officer Maya Bennett came back through the secured door with a local detective behind her, and the kind of focus that meant she had found something worth bringing personally. "Calloway is in the building," she said. The whole corridor seemed to sharpen. Bennett continued. "He came through the physician entrance with hospital counsel and 2 patrol officers he called through a private contact. He says he is here to give a formal statement and push for charges." Kessler's mouth flattened. Of course he is. Voss took the tablet from her hand and skimmed the updates. "He wants the first public version of the story. He wants a shield," Avery said. General Ryland turned his head toward her. "You know that tone. I know men who speak before evidence does." Kessler looked toward the elevators at the far end of the unit. "He will not come near my patient." Bennett's expression did not change. "He is headed this way." The Marines, posted at either end of the corridor, shifted almost invisibly into firmer positions. A young ICU nurse watched from behind the station, wide-eyed and pale, as the adults around her recalibrated a hallway that had already seen too much violence for one shift. Avery's gaze stayed on the closed elevator doors. When they opened, Trent Calloway stepped out in a clean charcoal suit and a white shirt with no blood on it. The change of clothes was an act in itself. He had washed the night off his skin and come back dressed for credibility. Beside him walked hospital legal counsel with her tablet held close to her chest. 2 uniformed officers from another precinct, and a man in a dark overcoat who smelled like private counsel from 50 feet away. Calloway saw the Marines first, then the dust marks still haunting the tile, then Avery. His expression tightened, but not with fear, not yet. With indignation that reality had not corrected itself while he was gone. "There she is," he said, voice carrying too far in the sterile hall. "Officer, that is the woman I told you about." Nobody moved to take Avery. The local officers with him slowed when they saw Bennett already in place, Voss near the glass, General Ryland by the ICU door, and Kessler looking very much like a surgeon who would happily remove one more problem from the building if someone offered him consent. Calloway kept going because stopping would have meant hearing himself. She discharged a firearm in a hospital. She performed an invasive thoracic procedure without privileges or authorization. She interfered with the code and physically displaced staff. This is outrageous. General Ryland stepped away from Luke's room. The temperature in the corridor seemed to change around him. He did not raise his voice. Men in his position did not need to. "You want to talk to me about outrageous?" Calloway faltered for the first time. "General Ryland, with respect, your son is alive because of definitive care in this hospital. But this woman's behavior..." The general cut through him without visible effort. "My son is alive because she refused to let your ego write his death certificate." The words hit hard enough that even the 2 outside officers shifted. Calloway's face flushed. She had no standing to make that call. Kessler answered before anyone else could. She made the right one. Calloway turned on him, grateful for a target he thought still operated inside the same civilian hierarchy. "Adrian, do not do this. This hospital is already exposed enough." Kessler took one slow step forward. "The moment you ignored tamponade and put a chest tube into the wrong problem exposure stopped being the thing that mattered." The legal counsel at Calloway's shoulders stiffened. "Dr. Kessler, we need restraint right now." Kessler's eyes never left Calloway. "Then restrain him." Bennett stepped between the lines before the hallway could become something even worse. "Dr. Calloway," she said, "you are not directing this scene." He looked at her in disbelief. "I called for police response." "You got it. I am standing in it." He took a breath, regrouping around contempt. "Then do your job. Detain her." Bennett extended a hand instead. "I need your phone." That broke his rhythm entirely. "Excuse me, your phone." "My attorney would advise against that." The man in the overcoat finally found his voice. "Officer, unless you have a warrant." Voss raised a tablet screen lit. "We have an outgoing message from Dr. Calloway's device sent 10 minutes before 2 armed intruders entered this floor." Bennett took the tablet from him and held it so Calloway could see his own words. "She is here. Come get her." The silence after that was not confusion. It was recognition. Calloway stared at the screen, then at Bennett, then at the officers he had brought with him as if one of them might rescue him from plain text. That is not what it looks like. General Ryland's gaze turned glacial. "Then explain it." Calloway's mouth opened, closed, opened again. "That could have been anyone. A colleague, a friend, my wife." Bennett's tone stayed exact. The number was a burner recovered near one of the assailants. The private attorney beside him stopped touching his sleeve. Kessler did not look surprised anymore. "Only tired. You tried to bury a bad call by handing the night to predators." Calloway snapped back, panic leaking through the polish at last. "I did not know anyone would come here. I sent a message in anger. That is all. I was trying to get her out of the hospital before this exploded." Avery heard the shift in his language and almost pitied it. Almost. That was the cowardice under everything else. He would not even own the malice. He wanted credit for the risk if it worked, and distance from it once it bled. "You knew enough," she said. He turned on her with desperate heat. "You destroyed this. You. If you had stayed in your lane, none of this." Avery stepped forward just once. The movement was small. Calloway stopped talking. "You had a dying man in front of you," she said. "You chose comfort over truth. Everything after that came from the same place." Bennett nodded to the nearest officer. "Dr. Trent Calloway, you are being detained pending charges related to obstruction, evidence tampering, and coordination connected to a violent felony event. Give me your hands." The words did not seem to reach him at first. He looked at the officers he had brought, then at legal, then at the Marines, then at General Ryland. His world had always supplied him with a ladder back to safety. A father on a board, a title, a coat, a script. This time, all the ladders had burned. "You cannot do this," he said. And now he sounded younger than he had all night. "My father sits on this hospital board." Voss spoke for the first time in nearly a minute. "Not anymore." Every face turned. Voss checked a message on his phone and slid it back into his pocket. "He resigned 14 minutes ago." Calloway went pale. The nearest officer took his wrist. This time, Bennett helped with the turn and cuffs herself efficient and without drama. Calloway resisted for half a second, enough to lose balance enough to be pressed against the wall in front of the sealed ICU unit, where Luke Ryland kept breathing behind glass. The sight of that seemed to finish him. Not because it created shame, because it removed audience from him. He had wanted the hallway to witness his authority. Instead, it witnessed his smallness. As Bennett guided him toward the elevator, he twisted once to look back at Avery. "You did this." Her face did not change. "No," she said, "you did." The elevator doors closed on him with a soft, mechanical sound, completely unworthy of the amount of damage he had just carried out of the hall. Silence returned in pieces. The private attorney left first. The hospital counsel stepped back to the wall and stared down at her tablet without seeing it. One of the outside officers muttered something to Bennett about reports and evidence and followed after her. Voss began issuing instructions in a voice low enough to keep the rest of the floor calm. The Marines remained where they were. Kessler rubbed his brow once, then went straight back into Luke's room. Avery stayed where she was for a second longer than anyone expected. She had been moving on pure function for hours. Now, the danger had narrowed instead of sprawling. Calloway was gone. The attackers were contained. The ICU perimeter was set. The building had not settled, but it had stopped actively collapsing. That left room for other things to rise. Pain in the forearms from holding pressure too long. Heat behind the eyes that had nothing to do with tears. The memory of a heart in her hand. The smell of suppression powder and blood tangled together. The knowledge that her cover was gone so completely it would never exist again. General Ryland came to stand beside her at the glass. Inside the room, Luke looked younger unconscious than he had in the trauma bay. Stripped of grit and blood, stripped of purpose, reduced to the vulnerable fact of being someone's son under too many wires. "He remembers you," the general said. Avery did not ask how much. "He said your name in there. I heard him." The general watched her reflection in the glass, rather than her face directly. "He served on a retrieval perimeter 2 years after you vanished. Came back talking once about a surgeon who could open a chest in a blackout shelter while mortar shook the walls." Avery's jaw tightened. "He did not know it was you then. Just the story." Kessler stepped back out before she could answer. "He is lightning under sedation," he said. "Not fully awake, but responsive enough to trial command following." The general was inside the room before the sentence finished. Avery hesitated on the threshold. Kessler saw it. "You should be there. That is not what he needs." Kessler's expression sharpened. "You do not get to decide that alone." She looked at him then. Really looked. Somewhere in the last 4 hours, the cardiothoracic surgeon who should have hated every variable she introduced into his hospital had become one of the few men in it not trying to own her. He held the door. Avery went in. The room was warm from machines and hidden heating elements, the air touched with plastic and antiseptic, and the metallic ghost of blood that no amount of cleaning ever fully erased. General Ryland stood at the bedside with one hand resting carefully against the rail. Luke's face was pale above the tube, but his skin no longer had the gray undertone of impending collapse. His eyelids flickered once. Then again, the ICU nurse leaned in. "Luke, if you can hear me, squeeze my hand." Nothing. A beat later, Luke's fingers twitched. The general bowed his head briefly, one private fracture in an otherwise rigid frame. "Son," he said, voice low, "you're in Tacoma. You're safe." Luke's eyes opened halfway. Murky at first, tracking badly, then finding the nearest shape, then the next. His father, the ceiling, the vent tubing, and then Avery. The moment recognition touched his face, it changed the room. He did not startle. He fixed. His hand lifted weakly from the blanket, trembled in the air, and searched. Avery stepped closer on instinct before deciding whether she should. His fingers brushed the back of her wrist. Barely enough pressure to count. His lips moved around the tube. No sound. The shape of the word was still clear. Sloan. General Ryland looked from his son to Avery and understood more in one breath than anyone had told him outright. Avery put 2 fingers lightly against Luke's forearm, grounding without restraint. "Easy," she said. "Don't fight the tube." His eyes stayed on her. Glassy, still but awake enough now to know the difference between a stranger's face and one dragged out of memory under bad lights. Emotion moved across him in fragments too small for anyone but Avery to read. Not relief exactly. Not surprise. The shock of finding a ghost alive and standing over you while your chest still hurt where death had tried to hold on. The ICU nurse adjusted the sedation, let him hover there for another moment, then let him drift back under. His hand loosened. Avery withdrew hers before it could become something she would have to explain. The general exhaled as if he had been standing inside barbed wire and someone had finally cut one strand. He is still in there. Kessler checked the monitor himself, yes. When they stepped back into the corridor, dawn had begun to gray the eastern edge of the windows at the far end of the floor. The storm had not broken. It had only changed color. That was when Franklin Shaw arrived again with the board chair on speakerphone and 3 new shades of panic under his eyes. We need to address this before the morning cycle locks in, Shaw said. Kessler closed his eyes once, as if considering whether homicide in an ICU corridor was still a career-ending act after everything else the hospital had tolerated tonight. The board chair's voice crackled through the phone. Dr. Kessler, we require an incident timeline confirmation of who performed which procedures and legal guidance on public exposure. Kessler took the phone from Shaw and spoke toward it without moving an inch from Luke's door. You will get a timeline. You will get a clinical account. You will not get access to this patient, this hallway, or my staff until I decide they are not running on fumes. The board chair hesitated. The physician of record is in custody, Bennett said from the far end of the hall as she reappeared, hand already full of paperwork. That quieted the line. Voss looked at Shaw. Your public statement is simple. There was a security incident. The patient is receiving critical care. The hospital is cooperating with law enforcement. No names. The board chair came back thinner than before. And the woman on the video. Kessler's eyes went to Avery. She stood with dried blood on one cuff and the disposable hospital badge clipped crooked over the false name she had worn for months. Avery Wells, R.N. The lie looked smaller now than it had downstairs. Kessler answered before anyone else could. She is a doctor. Shaw blinked. We have no privileging file for that. Then fix your paperwork. The board chair's tone sharpened with administrative reflex. Credentialing is not a switch, Dr. Kessler. General Ryland stepped into range of the phone. Turn it into one. Nobody on the line argued with him after that. Shaw's legal counsel looked at Avery carefully, as if recalculating all the ways the institution might survive her. If Dr. Calloway's privileges are suspended, trauma leadership falls to interim assignment. Kessler did not take his eyes off Avery. Correct. The counsel hesitated. You cannot be suggesting. I am. Avery's mouth tightened. No. Kessler finally turned to face her fully. Yes. The corridor seemed to listen. He went on quietly, which made it land harder. This department nearly killed a patient because a man in a white coat cared more about not being challenged than about being right. It then allowed armed men in scrubs to reach my ICU. The only reason Harbor Ridge is not a morgue and a scandal crater this morning is that you saw what everyone else missed and acted when everyone else froze. That does not make me a department head. It makes you the only person in this building I trust to rebuild the room that failed. Avery looked down at her hands. The skin across the knuckles was cracked from scrubbing. A line of dried blood had settled at the edge of one cuticle. They looked ordinary enough now that no one passing the corridor would guess those hands had been wrapped around a heart before dawn. My conditions, she said. Kessler nodded once. Name them. Nurses speak in trauma and get heard the first time. Residents learn physiology before ego. Debriefs after every catastrophic case. Security control at every critical care threshold. No administrator changes the clinical flow from a conference room. Shaw started to object. General Ryland looked at him and he stopped. Kessler said done. Avery raised her eyes. Interim only. For now. She let the answer sit. Then she reached up and unclipped the plastic badge from her chest. Avery Welsrien. The letters meant nothing now. Less than nothing. They were the shell of a person she had built because it was easier to survive invisibly than to live as what she had once been. Nina Parker appeared at the ICU station just in time to see Avery turn the badge over in her fingers. Nina had changed gloves 3 times since the shooting, delivered meds to 2 rooms, cried once in the bathroom without letting anyone hear, and still somehow ended up here because some part of her understood that nights like this drew a line through your life, whether you wanted them to or not. Avery looked at her. Nina went perfectly still. Then Avery dropped the badge into the red-lined disposal bin beside the desk. It hit the bottom with a small plastic tap. The sound was not dramatic. It was final. Nina's throat moved. What do I call you now? Avery held her gaze. Doctor. Nina nodded too quickly, and tears rose in her eyes before she could stop them. Yes, Dr. Sloan. For the first time that night, something like the ghost of a smile touched Avery's mouth. It vanished almost immediately. Below them, the emergency department kept running. The chest pain in bed 3 still needed management. The man in bed 9 had finally gotten imaging, and surgery wanted to know why nobody had called them 30 minutes earlier. Mrs. Delaney in 12 was asking whether she could please have dry socks and whether someone could tell her daughter she was all right. Harbor Ridge was bruised, breached, exhausted, and still open for business because that was what hospitals did. They bent under impact and then demanded fresh hands anyway. Kessler glanced toward the stairwell. Trauma Bay 1 is cleaned and reopened. Avery followed his gaze. The corridor, lights hummed softly overhead. Behind the glass, Luke slept under sedation with one repaired ventricle and too much story still attached to him. General Ryland remained by the room door, not as a commander now, but as a father refusing distance. Voss stood farther back on his phone, already turning the next problem into an operation no one else in the hospital would fully see. Avery took one breath, then another. Fear was there. So was memory. So was the old exhaustion that had driven her into a borrowed name and a civilian night shift where she thought work might stay small enough to survive. None of that left. It simply stopped being the only thing in the room. She looked at Kessler. 1 hour. He frowned. 1 hour for what? To shower. Change. And then I go downstairs. Kessler's expression eased by a degree. Good. General Ryland heard and turned his head. My son will ask for you when he wakes properly. Avery nodded once. Then he can wait 1 hour. It was such a normal sentence under such abnormal conditions that it nearly made Kessler laugh. Nearly. She walked toward the locker room without ceremony. Nina fell in beside her, not speaking, just carrying the strange relief of following someone who knew where to put her feet. At the door, Avery stopped and glanced back toward the ICU one last time. Through the glass, Luke's monitor kept beeping. Not loudly, not heroically, just steadily. Enough. When she came back out in clean hospital scrubs 45 minutes later, her hair damp at the temples, and the last visible blood gone from her skin. The building looked different only because she did. There were still officers in the hall, still Marines, still media downstairs, still reports waiting, still a federal case unraveling behind every sealed chart. But the disguise was gone. The elevator carried her down to the ER, where the first pale light of morning mixed badly with fluorescent bulbs and made everyone look as tired as they felt. Denise Rowe stood at the board with a marker and a fresh cup of coffee that smelled no better than the last. She looked up when the doors opened. The entire station looked up with her. A resident started to say Nurse Wells and stopped himself halfway. Avery crossed the floor, glanced once at the board, then at the waiting room metrics, then at the trauma bay she had opened with steel in the middle of the night and found clean again. Ready. She set a chart on the counter and said, "Who has bed 3? Nina straightened automatically. "I do. Bring the ultrasound." The resident nearest the physician desk blinked. For chest pain. Avery looked at him. Not harshly, not kindly either. Just directly enough that he felt the difference between being corrected and being instructed. For the patient, she said, and the department, bruised and breathless and newly aware of itself, moved.